Jan Talma.
Chairman, thank you very much. And congratulations to this process, Dr. Mslat. I think it's fantastic and the right way forward. I'd like to just ask a question on to the panel and pity the ministers away on the technical process. And I'd like to talk as a clinician, as a doctor working with patients. And I work in the public, the private, and also but in training students and registrars but in public. I think the patient is terminally ill, and we must treat it from a doctor's point with psychotherapy, and then with some medicines from aspirin and other things, and then we must treat it with surgery perhaps. And to us it feels the doctors are enthusiastic, something must happen. And it feels as if the psychotherapy part is over and that we must start working on the treatment now, as you said yourself, that we pass the political phase. My question is, will the technical processes be opened up? And why I ask it, doctors in general are concerned about the practical implementation of this whole process. And it goes about management and finances. We're not that good in finances. Technical people must look at it. But doctors are really concerned in the private sector also. How will they be allowed to function as clinicians? In the past, we've been limited more and more by outside role players what to do. Doctors can't do the best for the patient because they're limited by private sector, by the funders, public sector, by management problems, which limit them to act even often ethically. And that is what I think a big concern is. And lastly, on the process is, will this technical process be opened up? Or is it only going to be on the principle of input to the department and the government? So is there going to be an open technical process where doctors and nurses and everyone is going to be involved in the determination of the actual detail that we're going into now? We're really concerned, the proposals to the green paper, will they be for the public domain? On the moment, it's not all available. So we're concerned that there should be an open, transparent process where everyone is around the table. We're quite committed to this process, but we must be part of it.
Okay. Moderator, I'm going to sort of give my closing comments at the same time in an attempt to respond to what the last speaker said. And I just, I think in closing on my side, I certainly wanted to reinforce this building of bridges issue and the narrowing of gaps. I think both ideological gaps and operational gaps is what I'm referring to. And I think we need to sort of make a concerted effort across both sectors to see how we can try and find each other. And I think if you try and find each other, I often find, the minister mentioned an issue around drug pricing. And it's a pity he's not in the room, but it's quite interesting that when you sit across a table as a private and the public sector, and you spend time engaging each other and understanding each other's viewpoints and vantage points, etc., it's incredible how much a gap starts narrowing. It probably never narrows completely, but you can always aspire to that complete narrowing. But I think that often sort of we don't understand where the department's coming from and vice versa. And I think we need to continue creating an unpolluted environment where we can have those type of dialogues, start finding each other. And then I think all the technical things that the doctor spoke about now, the rest, I think those things can start falling in place. So sort of my last message as I leave here today is I think we've got to make a concerted effort to try and find each other. And you often lose each other because diary commitments don't allow it, etc. And I certainly think, Percy, this type of dialogue is crucial to the future of the country, not just healthcare. Because I think if we don't get it right in healthcare, I think pretty much everything else around us will collapse in time. So I think you need to be commended, Percy, for this initiative. And hopefully this will spark further dialogues of this nature. Thank you.
The problem you have raised is it's a serious one, because having looked at international best practice, especially in terms of what is suggested by the Green Paper, in terms of how pricing might be determined. It's a very technical issue, and that is why people are anxious. That is, practitioners or service providers are anxious about what kind of methodology is going to be formed. That is why the issue of pricing, as is proposed by the minister, will require that all of us who are citizens should come to the party. Let's work together and contribute to the process. Because this is a process that needs, first of all, research. You can go to Germany and steal their or copy their process of how they determine the diagnosis-related groupings, which is suggested by the Green Paper. But will it be informed by the same things that informs it in Germany? No. So maybe that is why we've been given 14 years until it is going to be implemented. There's still a lot of work to do. I think we must all accept that the Green Paper was just that. Green, therefore flexible, therefore breakable. We will need to contribute into the White Paper, and we must demand to be heard. Hence, this kind of dialogue has started, and we must not absent ourselves from these opportunities of this discussion.
And I think what one needs to remember that healthcare, really, the actual provision of healthcare is a very practical undertaking, and there's a lot of expertise that exists in the marketplace. There's a lot of skills, there's a lot of knowledge that could be tapped into. But what is preventing it at the moment, I think, is this big gulf. There's this big divide between the state and the profession and other service providers, the hospitals and so on. There's a suspicion that needs to be bridged. And I agree absolutely with what Stavros is saying, that we need to find a way of coming together. Because at the end of the day, we all want to remain in this country, and we want to have the best healthcare possible for the people of this country. But it's not a simple issue. It's very complex, but the more people that this whole process can be opened up to, and the expertise wherever it may reside, we should be able to tap into it. So, I mean, that's my view.
Jan, from all what we have said, I want to pick up just one statement. That said, as doctors, you are worried about practicality of this. You see, also us as nurses, we've been very worried about that, precisely because we are almost saying we're sick and tired of policies that get developed and implemented that at the end will have a huge impact on us as nurses, when we were never part and parcel of development of those policies and so forth. So that's why now with NHI, we have adopted an attitude that says, no, we are going to ask the government now and again. For an example, Saturday, we had our National Executive Committee from Friday to Sunday. We called UDG to come and address us on this NHI. Exactly what is it? Maybe because as nurses with us were very practical, we're really on the cold face of healthcare services. Now, we asked her to come and explain to us, how is it going to work, and so forth. It is in that vein that we then realized, because again with us, when we are, for an example, we're all here, we're health professionals. But when you go to COSATU, it's another terrain at all. Here is this powerful entity that they might not be that much sensitized about what really needs to be done. For them, it's just excited, we're moving NHI and so forth. So when we are in COSATU, we're playing a different role than one would play when you are here. Actually explaining to people that it's not something that can be done overnight. And we'll then explain the challenges that the healthcare system is faced with and say, let us persevere. You get what I mean? But now as health professionals, we have then said we need to see what role can we play. For an example, with the 10 sites that have been now announced, we will be going in there, looking at the human resources issues, infrastructure, so that we can then comment on what needs to be done. Rather than us wanting to be the victims of the change, let us rather influence how the change unfolds. For us, that's the attitude that we have. And it will work it will really work well if you can work together. Because if you look at the international level, there's a structure that I like so much, Fezel, that consists of nurses, doctors, and pharmacists at an international level. We always meet in Geneva. And I find out and say, I wish in South Africa we could also have that kind of a forum where we can really say, define what role are we playing with all health reforms that are taking place in our country.